Welcome to episode 307 of the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs and Security First IT. And joining me is Donna Grindle of Carden. Good morning, Donna.
Good morning, David. Love that look. Donna's here again. Got to put up with that crap.
It's Friday.
I feel the same way.
Yeah.
It's Friday and a holiday weekend.
Oh, yeah. Which, what's the importance of holiday weekends?
Ransomware attacks.
Exactly.
Cyber attacks.
So I'm sure in the next few weeks we'll be reading about something that happened, maybe even Monday.
I know.
Well, not Monday. I guess everybody comes in Tuesday and you'll find out that you got ransomware.
No, you're going to have the poor people that are working on the weekend because all the people that normally do the job have taken the weekend off.
Mm-hmm.
They've taken Monday off and you're monitoring systems and you don't know what you're doing. That somebody's going to be calling somebody else in the wee hours of the morning, guaranteed between now and Tuesday.
Yeah. I'm sure today around 3:00, somebody's going to say, nothing ever happens. You'll be fine. See you Tuesday.
Bye.
I won't be able to be reached. So
I love it.
Yeah, it's always crazy. But so anyway, today we're going to be talking about Peachstate and an OCR settlement.
Yeah, Peachstate, not a Peachy OCR settlement.
Yeah, so we haven't had a OCR settlement in a little while, other than the right of access type stuff. So,
and boy, this one's raising some eyebrows.
Eager to get down into it. And as always, when you just look at the headline, it's not sexy. It's like, 25K, not too bad. Scroll on. Let's see what else is happening. But
keep moving.
We like to dig down into it. And
wow.
Yeah, there's a lot.
I'm reading
more.
It and I'm like, wow. Wow.
Yeah. So before we get into that, though, do want to remind you we have the HIPAA boot camp. Can you say HIPAA boot camp? Virtual edition, August 17, 18, 19. And still have a few slots left open for that so far. Maybe.
I don't know. I haven't checked, but the last I heard, they were asking me where to cut it off.
It's tight. Yeah. So just email me. I'll slip you in the back door.
Jeez.
Anyway, so go check that out at thehippabootcamp.com for more information. As always, want to shout out to our donors, and we do appreciate your support. If you like today's episode, share it out. If you don't like it, please don't tell anybody. All righty.
Hey, the new thing where you can go review us on the website. We need to remind folks we have a new little widget. I don't remember where you put it, but there's a new widget on the website, and you can go there and click and enter a review of the podcast right there. We would really appreciate it, unless you're going to be like Roro.
Why, Roro? Oh, is that the one that did the 4-star?
I absolutely love it.
Yeah.
Someday Roro is going to say, "Hey, nice to meet you," and we're going to be like, "It's you."
Tackle him. Take him down. Sorry.
That's all right. We appreciate that you love the podcast.
Yeah. It's like fantastic review. But people don't read the reviews. They look at the stars.
People connect with me on LinkedIn and they're like, great podcast list. I'm a loyal podcast listener or any of those kind of things. And I'm like, we're so happy to know people are listening. It doesn't matter.
Yeah. Well, I mean, I don't know. We sometimes act like we have a small podcast or whatever, but I mean, we do have podcasts that's actually in the top 5% of all podcasts.
Yeah.
So, I mean,
yeah,
we're a pretty big deal.
That was exciting when we saw that. Top 5% of global podcast.
Yeah,
I'll take it.
That's pretty massive, honestly. Mm-hmm. So
considering that it's,
a niche of a niche of a niche. Yeah. It's like I emailed somebody yesterday and I was like, we're going to make the HIPAA boot camp fun if you consider HIPAA fun.
Well, and threat.intelligence listed us as in the top 20 data breach websites.
That is
I
true.
didn't know there were 20, but I'll take it.
Yeah.
That tells you something, that there's 20 of those.
Yeah. 20, well, it's 20 podcasts, wasn't it? Top 20 podcasts. So yeah,
we're on the list, and the list is alphabetical. At first, I'm like, why are we way down there? Oh, H. H. Everybody else is using C and D.
We should change it to A, help me with HIPAA podcast.
A, like the plumbers, right?
Yeah. AAA plumbing.
Yeah. All right, then. Please,
all right.
Do your duty. And
duty.
I know, I knew that was coming. I mentioned plumbers and duty, and I knew you were going to do that. All right, so moving right along.
All right, now for our HIPAA
Say what
segment. So, get an email yesterday, and part of the email reads, as I'm building our HIPAA program, I came across some things I do not completely understand, even after reading the government sites and guidance. To which I say, yes, I understand completely. And it continues on. So another question, is there a podcast that goes into detail about what is required for an audit? How frequently you need one? I think I read 6 years.
6 per year.
Yeah, 6 per year. That's right. And how best to document the audit details and common mistakes? That's the question. So good news, there is a podcast about that, and you're listening to it.
I think they may have been asking for an episode, which we've done audit episodes, but that would be a good one for us to do, is what would we go, just what should you audit?
Yeah.
But we do have things on auditing logs and auditing policies and procedures and stuff.
Yeah. Well, here's something I did not send to you as part of this question. Her next paragraph goes on to say, if you need content ideas, I have millions of questions. something to that effect. Okay. So we may be prodding her for more content ideas. Not that we have a problem finding content, but when it comes to what to audit, how to audit, what are they looking for? Definitely listen to today's podcast. Anytime we talk about OCR settlements, we're talking a lot about what OCR is looking for. And so yes, that's going to give you some clues. But what else do you have to say about this question, Donna?
Well, a lot of people will say to me, well, I don't want to get audited. Okay. OCR doesn't audit. That there's a random audit program, but it's just, there's less than 500 ever done since 2009. So this is not a regular thing from OCR. So I wanted to be clear. These are the audits that we would talk about, your internal audits, which are also not assessments or risk analysis. Mm-hmm. So let's be clear. They're all different. And, they keep saying OCR will launch the random audit program, but for now we haven't seen it. So we're going to just not include that. They do compliance reviews and investigations. Yeah. Mm. Anyways, with that in mind, there is no specific audit requirement under HIPAA because you're supposed to do
reasonable and appropriate.
There you go. So in our view, any policy and procedure that requires certain things to be done, you should have a plan to audit that those things are being done. And that would be in your policy and procedure to do the audits and how often. And then you could look at each individual case. So things like, I have a policy and procedure that I'm going to do patch management. Okay. Well, how's that patch management going to be done? Well, I need to audit that that's actually happening. And I do that by monthly reports, quarterly reports, and making sure someone actually looks at them. But then when we get into the settlement, we'll talk again about the auditing, but you should be auditing your policies and procedures for performance. Are they adequate still? Are they being followed? Do they need to be updated? And, having that whole process needs to be built in. And do you know that many people may not know that we give away a free HIPAA compliance management plan?
Shut
Nice little
up.
poster.
No
Yeah.
way.
There's a minimum and an aggressive one or advanced, but extra credit. That's the one you should go with, because but it's out there, and all you have to do is go to the website. It's under the resources. You can download it and happily have your own copy to put up in your office, which we suggest, and it plans out audits and those kind of things.
Yeah, we should make it into a t-shirt.
Oh no. You better get those t-shirts done. You keep threatening those t-shirts. You haven't done the t-shirts. You're talking about the t-shirts. Today you're wearing a Sec First t-shirt. Yeah, I know you're proud of that. I'm wearing my Cardin ones next. I'm gonna wear a Murphy shirt.
There you go.
Yeah. But that question was perfect to go with how this cap came about. I mean, just how they ended up doing the investigation was crazy. Never seen that before. And then what they put in that cap and how long it is, you got to wonder what happened in the background. That's all I'm saying.
Yeah. The headline is never important. So let's dive into this, because there were quite a few things just like, what?
Yeah. So well, where is the headline? I know I put it in here. You see it?
Clinical laboratory pays $25,000 to settle potential HIPAA security rule violations.
Yeah, there. And I'm like, oh, $25,000. Huh. So, that ruling about the MD Anderson saying you can't hit us with all these fines and penalties. And OCR is like, okay, we'll just make it harder on the back end. Yeah. And that's basically what this looks like, because it is way more than anything I've ever seen.
Yeah. I know when I first saw it, I didn't have time to get into it. So I saw the headline, $25,000. I'm like, huh, okay, I'll read this later. And as always, you get down into the meat of it, and you're like, ooh, wow, this is worse, a lot worse than it looks like on the surface.
Yeah. So, we have a process. We look at the press release, find what they say there. And then we go dig up the information and read the actual settlement agreement. And that's where the good stuff is.
Yes.
So in their press release, it says that in December 2017, okay, so it's not as, a lot of these been older, OCR initiated a compliance review of Peachstate to determine its compliance with the HIPAA privacy and security rules. And here's where we don't like hearing these words. OCR's investigation found systemic non-compliance with the security rule, including failures to conduct an enterprise-wide risk analysis, implement risk management and audit controls, and maintain documentation of HIPAA security rule policies and procedures.
I think they just have that paragraph already typed up for every one of them, and they just stick it in. Because every single one of them has the same thing.
Well, and it's like whenever you see you don't want your name next to things like systemic non-compliance and the failure to implement basic security rule stuff is what comes up in the quote from the director, which is I'm leaving that one to you. We've gone through it recently.
Yeah.
We're either going to have to learn to say the name. We're going to have to call.
Yeah. The systemic non-compliance is, if I had to put a definition on that, that would be them saying, you ain't even trying.
Yeah. It's just right above willful neglect, right? You know.
Yeah, you ain't even trying.
Yeah.
But Robin Sue, she says clinical laboratories, like other covered entities or covered healthcare providers, must comply with the HIPAA security rule. The failure to implement basic security rule requirements makes HIPAA regulated entities attractive targets for malicious activity and needlessly risk patients' electronic health information. This settlement reiterates OCR's commitment to ensuring compliance with rules and protect the privacy and security of PHI.
So there you have it. Systemic noncompliance.
You ain't even trying.
You ain't even trying. And basic cybersecurity rules.
Again, you ain't even trying.
Well, and you know, the thing is my question was, you know, a lot of times the phrases matter.
Oh, yeah.
When the lawyers are saying it. My question is, it says the failure to implement basic security rule requirements. Okay. Are they saying that the HIPAA security rule is basic requirements, or they didn't even do the basics of the basic requirement? Because we say HIPAA is alone a basic bare minimum floor for cybersecurity.
Mm-hmm.
So if you didn't even do the basics of the basic, you ain't trying. Is like it. I mean,
it's like I said, you ain't even trying.
You ain't trying.
Yeah,
but that's how bad you're not trying.
It makes you feel like, oh, there's advanced security rule requirements.
No, that's why I'm like, I'm not quite sure what that means. Is, you know.
Yeah, I think what they're saying is that security rule requirements are the basics of cybersecurity, and you're not even doing that.
Yeah, not like you're not doing the bare minimum of HIPAA. You're not doing the HIPAA, which is the bare minimum of cybersecurity.
You ain't even trying.
You ain't even trying. Stop crying. You ain't even trying. Until you're trying, I won't hear about it. You know, been there, done that. So here's the thing, though. We read all that, and my guess is if you know that first investigation notification letter came in, and that was what I thought. You know, based on something, it didn't really happen, and then they put them on a 3-year cap.
Yeah,
3.
That's the first thing that caught my eye. I'm like, what? 3?
Yeah. So we haven't seen a 3-year cap since the Med Informatics debacle, the which is the EMR, small EMR company that had a hack years back. But here's the trickier part: is how they even ended up in this investigation.
Mm-hmm.
So remember, they opened this investigation in 2017, right?
Mm-hmm.
To Peachstate. And I'm like, okay. Where it starts here, it says on January 7th, 2015. And I'm like, okay. So it goes back to the VA reported a breach involving the VA's telehealth services program, which was managed by a business associate, Authentidate Holding Corporation, AHC.
Oh, so
I'm
business,
like, what?
Yeah, business associate here.
Right. So first of all of you that I'm the business associate, it's covered entities. No, they were investigating the business associate who was managing the telehealth services that the VA used and reported a breach.
Mm-hmm.
Okay, but what does that have to do with Peachstate?
Yeah, this is where it gets
squirrely.
Interesting.
Yeah. So we had the 2015 VA that they looked into. And then after going through that, they end up saying in August 31st, 2016, well, we're going to do a compliance review of AHC. During that review, they learned that AHC and Peachstate had entered into a, quote, reverse merger in January 2016. Okay. I don't know about you, but I really had to go study the reverse merger thing.
Yeah. I was like, I don't know what that is.
Yeah. But at that point, OCR opened a new compliance review into Peachstate. All right. So the VA breach caused an investigation of the VA, which led to an investigation of the BA who is AHC, who then did a reverse merger. So OCR started a new investigation into them. Okay. We've never had it that confusing. And just for the record, a reverse merger is a tricky little move where a public company buys a private company, but then the private company begins to operate out of the shell instead of the other way around, where the public company usually absorbs the private company.
Mm-hmm.
This is the other way around. So it basically lets a private company private company become a public company without going through an IPO.
Interesting.
I know it's squirrely legal stuff, and that alone, OCR went.
You ain't even trying.
We're gonna need to see some more. We're gonna need to see some more. We're
Yeah.
gonna need to see some more. So basically, all right. So the AHC, they were looking into them. They acquired Peachstate, but then Peachstate begins operating the labs within that public company, and kind of absorbs in what AHC was already doing, or completely gets rid of it sometimes. So that alone, that investigation started 2015, and now they opened by 2017 the third part of the same investigation. So all of you people who think it doesn't keep rolling, they always say they'll go where the investigation takes them. This one, I just said this one's like a well-known battery bunny. Keeps going and going. All right. So then they hit on what are the official findings when we get into the third round of this investigation. What is it that they found? Guesses for the first two?
I mean, no doubt they didn't do a SRA.
Yeah.
And of course that leads to the second one, which means they didn't have a risk management program.
Yeah. And you can't really have a risk management program unless you did an SRA.
Yeah. I mean, it's,
we've actually done those assessments where I've asked, did you do it? No. Do you have a risk management plan? Yes.
But that's why we always tell people, you can't start at step 3 or 4 or whatever. You got to start with the first thing, which I don't understand why it's so difficult to start with an SRA. I just don't know. Is it because people don't understand what it is? They don't understand that it's a requirement. I don't know. But
I think a lot of people, and years ago, OCR published a thing explaining the difference between a gap analysis and a risk analysis.
Mm-hmm.
So a gap analysis is looking, what does HIPAA require and are you doing it? Whereas a risk analysis says, I need to protect my PHI. What could go wrong and what do I plan to do about it?
Mm-hmm.
They're two very different things. And I think a lot of people do the gap analysis and some paperwork.
Right.
Or a spreadsheet that somebody gave them. But it's pretty much automatic. If you don't have an SRA, you're not going to have a risk management plan.
Mm-hmm.
Or if you do, I want to see the risk management plan. I really do. What threats have you identified?
Everything.
Our threat is that we don't have a policy and procedure on something.
Yeah. No, I like the ones like, oh, we don't really have that many threats. As we've often said, if ransomware is not listed in there, you ain't even trying.
Yeah.
Because it is definitely a threat.
I know. So it's interesting to see. But then the next thing on their failure, there was a very important point that I read in there that it may have been there and it just got past me before, but they failed to implement hardware, software, and or procedural mechanisms that record and examine activity in information systems that contain or use PHI.
Oh, so you mean to tell me if I'm a small practice and I don't have hardware or software that's able to look at system activity, look at log files, all that, if I don't have the ability to do that, it still has to be done?
Apparently, that's what they're saying.
So they need to find a procedural mechanism to accomplish that. Oh, okay.
Yeah. I we've said that before. And I've tried to encourage people to do random audits, and we're not getting anywhere.
Ain't nobody got time for that.
No. We're going to have Ray on to talk about all the stuff they're finding anyway. He says he's going to come on, and I just hadn't scheduled it. And those are always fun.
Yeah. This is one of those things where I know from my standpoint, it is very difficult to go into a small organization and say, we've got this thing that collects the data and does the examination and all that. It's going to be, put a number on it, $300-$400 a month. And they're like, no, paying $300 or $400 a month for that. But if you look at it, let's say first of all, you do have to address it. What are you going to do? Let's say you're just going to put somebody on it. How much money is it going to cost you to put a person in randomly spot checking stuff that they don't even know what they're looking at?
Mm-hmm.
I mean, I would imagine you're going to spend more money than $300 or $400 a month and not even get anywhere near as good of a result. So it's one of those things where it's actually a lot cheaper on you and a lot better to pay for a hardware or software solution that's going to do that.
I've probably had to say it 3 or 4 times this week. Security is always too much until it's not enough.
Mm-hmm.
Yeah. Yep. We were refinancing and doing it virtual.
Mm-hmm.
And the attorney goes, okay, thanks for showing me your IDs. If you'll just snap a picture of that and text it to us. And we're like, no. This cannot be done. I refuse. I cannot do it. I can't. Please don't make me, please.
Yeah. No.
No. And, thankfully it was like, okay, you don't have to. Just make a copy, put it in the, okay, I'll do that.
I had a client, and it's not been recent, but I remember them coming to me one time and their comment was, we've never had, and I do air quotes, we've never had a security issue. I don't think we need to be paying for this level of security any longer. And I was like, are you joking me or something? Is there like a hidden camera somewhere? I mean, that phrase doesn't even make sense to me.
No, it's like no self-awareness. There's a huge gap in self-awareness these days.
It's like,
and it spans the spectrum of human conversation.
Yeah. It's like, what you're doing is working so well, we don't want to pay for it anymore. I don't even know what you're saying.
It's kind of like, we haven't been robbed in so long, we're going to get rid of the doors.
It's like, wow, I don't know what to say.
Not only do we not need locks, we don't need the doors. Just get rid of them because we're not being robbed. Clearly, we're okay now.
Yeah. There is no risk of that happening.
Yeah. So, and the other point that this brings up that a lot of people, oh, well, IT takes care of that. So I do buy your program for $300-$400 a month, but then I'm not looking at anything else. So just because David's program is looking at everything on the network, that does not mean I don't also have to worry about other things, because guess what David doesn't do with his program? What logs do you not review with your program?
I don't review the EHR logs.
Yes. The actual access to the patients.
Yeah.
So those insider issues and those kind of things that we talk about, one of the top 5 threats under HIPAA,
mm-hmm.
You're not going to catch those.
Yeah. I mean, we cannot say this enough. If you're not having lots of conversations with IT on a regular basis, you're going to be shocked one day.
Yeah.
Because there are multitudes of things that you don't understand about what IT's doing, and they don't understand about what you want them to do. I just had a conversation yesterday with an MSP that was asking about a security risk analysis. And I said, you need to ask your customer, what is it they expect? Because what you call an SRA and what they call an SRA often are not the same.
True that.
He's like, really? I'm like, yes. I'm telling you, people don't.
Well, what you call one and what we call one's not the same.
No, it's like you don't even use the acronym. Okay. The acronym might start the conversation, but you need to sit down and go, what is it that you're trying to accomplish? What are you looking for? What are you wanting out of this? Because you will often find that what you call an SRA and what the IT people are doing, or what you want monitored and what you want logged and all that stuff. You know, if you call your IT company and say, are you monitoring our systems? They're going to tell you yes, but you're going to think, oh, they're looking at every single thing that my systems are doing and my users are doing. They are looking at every bit of it. No, that's not happening.
No. Well, I was trying to explain to somebody that, you know, just this week that MSPs do not have access to the EHRs. They don't do anything with them, the vast majority of them.
Right.
You know, they may get on the phone with the vendors, but that's about the back end of the stuff. That's not about how do I code this with, you know, set this up so that when I code this, it'll automatically do that. They're not in there in the user interface part.
Yeah. We see that sometimes in the dental space where IT will handle the dental software.
Yeah.
Every so often I've seen it, like when people use Metasoft. There's been MSPs that deal in that, but for the most part, most of the MSPs aren't. But that's questions you need to ask.
So if they're reselling the application, that is a different business associate than your basic MSP. Two different business associates. So anyway, and then of course they failed to maintain written policies and procedures. Maintain written policies and procedures and to maintain written record of any action, activity, or assessments required by HIPAA. And it actually says all of subpart C, like all of HIPAA. So you're not doing any record of action, activity, or assessments required by HIPAA or their own policies and procedures because they don't have them. So, but they're pointing out that if you have the policies and procedures, you are supposed to have a record of action, activity, or assessments that your policies and procedures require.
You didn't even try.
It just goes back to answering the question. So, you know, those are the four big ones that you would expect to see. So right now, go check your list and audit for that.
Right.
You know, do I have these things? And look up the definitions of stuff and cross-reference between a gap analysis and a risk analysis and those kind of things. But then the cap, so we got a squirrely way into this thing. And then we get the cap. And at first it seems pretty normal, maybe some shorter time frames.
And so, and if you're new to the podcast, I guess we need to bring up what a CAP is. So that's
sorry, my bad.
That's the acronym for Corrective Action Plan. And you know, typically we see these 2 years. And so Corrective Action Plan means OCR is going to be all up in your business for this amount of time. And they're going to give you a lot of homework to do, and they're going to give you time frames to do it. And they do like my old math teacher used to do, which drove me crazy. They always look at you and go, we need to see your work. But I got the answers. No, we need to see your work. They're going to do that.
Yeah. And just remember when you're being asked that David's imitation of his math teacher. So
it's exactly what you sound like.
Yeah. So 90 days, conduct the comprehensive enterprise-wide risk analysis. Okay. 90 days. I know plenty of groups that we're trying to get them to conduct one. And in 90 days, we're lucky if they've paid attention.
Yeah.
You know, But we've had to start bringing down the hammer, even on the smaller ones. Of if you don't have it to us by this time frame, we assume you don't have it.
Just
And
send them
no,
a
you don't
fine.
get no mulligans. You don't get to do do-overs. No.
Yeah.
So yeah. And I'm like, okay, well, that's and it's using that new language about including all electronic media workstations and information systems owned, controlled, or leased by. And you know what that is bringing in, right? Your AWS, your Microsoft 365, all of those things,
All your cloud environments.
your cloud environments, because you're leasing those or you control them.
Don, I wonder if you could start having like a corrective action plan simulation program.
Well, that's basically what we do.
I know, but you're going to give them these things, and if they don't do it, you're going to fine them.
Oh, that would be cool. Yeah, we have talked about that. You have to start paying extra for your assessment if it keeps hanging on. And we decided, nope, rather than making them pay extra, we're just going to give them a worse report. Take the same amount of money. But it, you're right. I mean, in a lot of ways, but a lot of people, just like these guys, other people see this $25,000. That's nothing.
Yeah.
And then this corrective action plan is not nothing.
Oh no, it's going to be a lot more than $25,000.
Oh yeah,
a lot more.
So you do your risk analysis, right?
Mm-hmm. Yep.
So depending on the size of the operation, yeah, you can get one of those. Let's just say less than $20,000, maybe.
Would you,
bigger operations, maybe more.
Would you say, and you don't have to speak for Carton necessarily, but just in your experience, would you say that should somebody come in and say, I need an enterprise-wide risk analysis, would it be different in pricing if they were also to say, by the way, I'm under a corrective action plan?
Well, potentially.
And you've got 90 days to get this done.
Yeah. Yeah. I mean, there's a lot. Let's just say things that, I can't talk about.
Mm-hmm.
There are cases where we're brought in and basically we put them on their own corrective action plan. And it involves some consulting and some planning and extra documentation, extra follow-up, a very specific, strict schedule, which is very different than what we normally do. Very different. So there is additional cost.
Okay.
And, but at the same time, it's not like I can go, oh yeah, well, that's going to cost you 30% more.
Right. Well, I imagine that because we know how people function,
yeah,
that if OCR comes up and says, you have to conduct a comprehensive enterprise-wide risk analysis within 90 days, somebody somewhere is going to wait till 30 days out and go, oh, we got to get this done.
Well, when you read the rest of this thing, know they better not be doing that, because the end of it is the worst part.
All right, let's get moving.
Yeah. So you've got the 90 days for the SRA, and at the same time, build your risk management plan, which is the way ours work. We do the full SRA. We provide a report for that. And we have a master report with our gap analysis and our recommended risk management plan, and spread it out, spread the wealth.
Mm-hmm.
But then both of those have to be approved by HHS. And then once they're approved within 30 days, they have to provide the policies and procedures. And I can tell you, to do those properly, we were just on a call that involved an attorney, and we were, let's just say, onboarding somebody with their attorney present for a reason. And the list of policies and procedures that we start in our core startup program, the attorney's like, I am so happy by all those names I see. And these are, this is not easy work to do that. And, it says you're going to get it, you're going to distribute it to all the employees. They're going to make sure within 15 days, new employees, and then assess, update, and revise as necessary the policies and procedures at least annually. There's your audit.
Yep. At least annually.
At least annually. And here's the thing, for the next 3 years, every single change that they make to a policy and procedure has to be approved by HHS.
All up in your business.
If you make a change to any policy and procedure, you have to send it in to HHS, get their approval within X number of the same time frames. And then once it comes back, you have to implement it and get everybody trained and all that kind of stuff for 3 years. Anybody violates the policy and procedure, you have to document all of that and say, what was their violation? Now, it's violation of policy and procedure. We're not talking about a breach. We're not talking about anything that requires notification. We're talking about violation of a policy and procedure. That's it. Nothing more.
And how often is it the leadership of the organization that tends to be the one to do that? So that, it puts the compliance people in a bad position a lot of times, because the compliance officer is like, doctor didn't do it, or he did do it, or whatever.
Well, and the beauty of this one is the leadership then has to attest that they have reported everything. And it also talks about training, where it points out the whole generic training alone doesn't cut it that we talk about all the time. Shall review the training at least annually, and where appropriate, update the training to reflect changes in, you ready for this, federal law, HHS guidance, any issues discovered during audits or reviews, and any other relevant developments. I'm sorry, but federal law is what most generic training gets. That's it. None of that other stuff.
Right.
But then came the big scary thing. I don't ever recall seeing this. Do you?
No, because when I looked at it first, I was like, what?
Yeah. I know. It's like, I was reading it. I was like, what are they talking? Designation of an independent monitor.
Yeah. Me being in IT, I'm like, what is that? Like a dashboard? You got to put a dashboard up somewhere?
It's just monitoring. It's flickering.
Yeah.
No, within 60 days of the effective date. So they're also doing during the first 60 days, they've got their risk analysis, their risk management plan, and they have to hire this independent monitor, plus some other stuff required within those first 60 days. Anyway, they have to designate an individual or entity to be a monitor. And remember, it says independent.
It's like a hall monitor.
Yeah, kind of. What are you doing out here? Why are you out here? Let me see your pass. Do you have a hall pass?
Yeah.
But it's supposed to be reviewing not just their compliance with HIPAA, their compliance with the corrective action plan.
Oh.
And they must certify in writing that they have the expertise in compliance with the HIPAA security rule and able to perform the reviews described in this section in a professionally independent fashion, taking into account any other business relationships or engagements that may exist.
Okay. Good luck finding that person.
Yeah, I mean, at first I'm like, wow, this could become a whole new line of business. And then the more I read, I was like, no, don't know that I would want that line of business. Because there's all kinds of stuff down in here. And it says that the monitor must retain and make available to HHS upon request all work papers, supporting documentation, correspondence, and draft reports, including those exchanged between the monitor and Peachstate related to the reviews. And Peachstate shall maintain for inspection and copying, and shall provide to HHS upon request all these documents and records related to compliance with CAP for 6 years.
Show your work.
I mean, there is so much detail about what that monitor has to do. So
Yeah.
OCR can question what the monitor review reports say. And there's all these rules where the monitor has to prove that they're not going to be easy on them.
Yeah, that's interesting.
Yeah.
I don't know where the monitor came in at, but I mean, maybe it's going to be something we start seeing from here on.
Yeah. And they make a point that just because there's a monitor doesn't mean that HHS can't come in and investigate themselves, investigate Peachstate more, even with the monitor in place saying everything's okay. They can still come in and it doesn't remove. I mean, there is a lot.
Yeah, we need to reach out to our OCR contacts and ask about that, see if they know anything.
Well, we got to wait until that spreads. That there's going to be a lot of talk about this. I can guarantee it. And then of course there's regular reporting is always there, you know, the annual reports and all of that. But they also have to do regular reporting from the monitor activity and the monitor's reviews. And, you know, there's the attestations to put the leaders, you know, on the line, so to speak.
Right.
Signed by an owner or officer of Peachstate attesting that the policies and procedures are being implemented, have been distributed to all appropriate members of the workforce, and that Peachstate has obtained all the compliance certifications to prove they're doing the stuff.
You got to prove it.
You know, that I'm used to seeing. But then in the further down in under the reporting, this wasn't under the monitor requirements. This was under the reporting requirements. And it says a summary or description of all engagements between Peachstate and the monitor, including but not limited to any outside financial audits, compliance program engagements, or reimbursement consulting, if different from what was submitted as part of the implementation report every year. This is interesting. We're gonna be monitoring what this monitor thing does.
I know. Yeah, that's very interesting.
Yeah. So I you know, the legal parts of that brings up so many things. I mean, to me, because there's so many legal requirements, I wouldn't want to take that on my own, but I would certainly do it in partnership with an attorney.
Yeah. Well, that just this piece alone with the monitor is substantially more than the actual settlement.
You think you're going to be paying that monitor $25,000 for 3 years of work?
No.
You think you're going to be paying them $400 a month? No.
No.
$1,000 a month? No.
It's going to be expensive.
Yeah. And you are required to do it because OCR is saying us watching over you, we don't even trust that. We don't trust you to have us watch over you. We believe you need to have another person required to watch over you that you pay for, but they have to remain independent. There's a lot behind the scenes in this one.
Yeah. Very interesting.
I concur. Now you know why I was saying like, wow. Wow. Oh my. Could it be?
Yeah.
I have never seen anything like this. And if this is an indication of where they're going, fine. We're not going to hit you with the cash. You know, we'll say this is what you can pay, or you can go on this corrective action plan. And whoa. So you ain't doing nothing.
You ain't even trying.
If you want to get some really interesting read, we have a link, go read that. We recommend anybody that's responsible for this stuff read these resolution agreements. I mean, it's how we develop the systems and the functions that we perform and the stuff that we do so that we're aware.
Yeah.
But
yes, like I said earlier, if you go through the corrective action obligations, and look at those things, it tells you exactly. Now, this is not like everything OCR is looking for. You would have to read, a number of them, but you'll start seeing a big part of what they're looking for. Obviously, you see an enterprise-wide risk analysis is one of the things they're looking for. A risk management plan, one of the things they're looking for. So all these things that they talk about, they're dinging other people for. There's your sign. That's what they're looking for you to be doing.
Here's your sign.
Yeah. So don't say I don't know what they're looking for. I don't know what I should be doing when they're clearly giving you all that information.
Yeah, it's there.
Mm-hmm.
No doubt about it. That's where we go, oh, let's up our game. Now they're upping their game. We're going to up our game. And I believe as we start to see how they announce that they're going to implement the high-tech amendment for recognized security practices, I think that we're going to start seeing some other specific things that they'll be mentioning about their findings, that because even if they do a settlement in this case, if they were doing recognized security practices, they would take that into account. But if you were doing recognized security practices religiously, as you have to prove you're actually doing it, they wouldn't be on this. This wouldn't be happening.
Right.
That's my opinion. Yeah. So heads up, but
things are changing.
Well, did you see there? I mean, we just reviewed the cyber executive order, and now the Transportation Safety Administration has come out with cybersecurity requirements of reporting for the infrastructure folks that you got to let us know. You can't keep hiding this stuff. If you know something's going on. And I think we're really finally, there's been enough bad stuff that we're heading into that area where we've known for years. I've been trying to say since 2012, I know you need these services.
Yeah.
And
finally, it's
10
amazing.
Years later, everybody gets it.
I know. I mean, we shouldn't be at the point now where we're having to convince people. It shouldn't be a matter of convincing you that you need it. You should know that you need it. It's just a matter of what is reasonable and appropriate for your organization. Not is it reasonable and appropriate, but what level of it is reasonable and appropriate.
I just told somebody yesterday that introduced me to someone who should really be investigated. But anyway, that basically I would have to convince them to do the work. And I'm like, I have plenty of people that are already convinced and they want my help to do the work. I don't need to do that work anymore.
No.
Now I can educate.
Listen to the podcast. That's about as close as you're going to get. I'm same way. If I've got a prospect coming in and I feel like I've got to convince them that security needs to be done, then I'm just not interested in that. You should already know that security shouldn't even be an option.
Number 2. That was a good one.
All right, folks, that is our show for today. Thanks for listening. Remember to share us out on your favorite social media and give us a rating. Yes, we do appreciate your help in spreading the word. Remember, for Donna and myself, HIPAA is not about compliance. It's about patient care.